Welcome to GynoCurious. I'm your host and creator, Dr. Amy Novatt. From both sides of the speculum, this show explores what it means to be a healer and to be healed. Let me know your thoughts and curiosities by writing to comment@radiofreerhinecliffe.org. And if you're interested in my clinical practice, please go to dramynovatt.com for more information. So today I'm doing one of my solo acts. For folks who want a bit of information, a bit of my perspective, a bit of science, here's to listening to what I have to say. Today's episode is about something that's often whispered about, dismissed, or simply endured in silence: pain with sex. Let's be clear, sex should not hurt. Unless pain is part of your consensual kink or sex play, discomfort, especially consistent discomfort, is a sign that something is off. And yet, through 35 years of practice as an OB-GYN, I have heard versions of this story over and over again. Cis women, trans folks, and non-binary people with vaginas sharing that penetration doesn't always feel right. Maybe it was a one-off, dryness from not enough foreplay, a new lube that irritated, or early hormonal shifts. But for many, the pain is persistent, unrelenting, and often kept secret. This episode is for you if you've ever thought, maybe this is just how sex is for me, or maybe I don't deserve more. Now is the time to get answers, support, and pursue pleasure. So what is sexual pain? The medical term for pain during sex is dyspareunia, and while it's common, it is not normal. Dyspareunia is part of the family of diagnoses referred to as female sexual dysfunction, or FSD. FSD refers to persistent difficulties with any stage of the sexual response cycle, including desire, arousal, orgasm, or pain that cause distress or interpersonal difficulty. About 43% of women in the U.S. experience some form of sexual dysfunction. But to be really clear, the key is that the individual expresses distress about the issue. It's a woman's subjective experience of dissatisfaction with her sexual function that makes the diagnosis. If there's no worry, no concern, then it is not considered female sexual dysfunction or a medical condition. So today I am just focusing on the pain phenomenon, on what is called the sexual pain disorder or pain during intercourse/penetrative sex. Dyspareunia can be caused by a complex mix of physical, emotional, and relational factors. Some causes are simple and treatable. Others are multifaceted and need a deeper dive. But all of them deserve attention. Let's talk about the physical contributors first. Vaginal dryness from hormonal shifts. Think about breastfeeding, perimenopause, menopause, or certain medications that can lead to drying. Infections, sexually transmitted infections, yeast infections, urinary tract infections, or even vaginal or vulvar skin conditions that can be quite common, like eczema, may be contributing to pain. Pelvic floor dysfunction, muscles that are so tight or in spasm, as in vaginismus, can make penetration really, really difficult. Deeper issues in the pelvis like endometriosis, fibroids, ovarian cysts, or pelvic adhesions can cause pain over years. Nerve pain or injury from past surgeries or childbirth can also contribute. Even chronic constipation can play a role in pain with penetrative sex. And then there are the emotional and relational factors. Anxiety, depression, or stress, which can translate into pelvic tension. Trauma histories that resurface in intimate moments. Disconnection from partners or from ourselves. A lack of communication, foreplay, or understanding can certainly contribute to this problem. And importantly, some people experience pain with one partner, but not another. I remember so vividly a woman I saw for years complaining of pain with sex, and no intervention seemed to help. Then one year she came into the office with this broad smile and said she had left her husband and was now with a new lover and was having the best sex of her life, sex without pain. Now, I'm not telling you to go out and find a new partner and all will be well, but please be aware that context matters. Relationship dynamics matter. So why don't we talk about this more? We have been so conditioned to believe that heterosexual intercourse is the centerpiece of sex. We've been taught that it's for procreation, for our partner's pleasure, that we should just push through, or that some pain is normal. It is not. This silence around pain, around female pleasure in general, has led to unnecessary shame, isolation, and suffering. Many women don't even know they're allowed to ask for help, or they're afraid to. They feel embarrassed, broken, or resigned. GynoCurious is here to stop that narrative right here and right now. Okay, so what do we do if sex hurts? First, acknowledge the pain. Name it. Know that you deserve a pain-free, pleasurable sex life. Second, talk to someone. Your partner, if you feel safe in doing so. A friend. And most importantly, a healthcare provider you trust. Don't let the silence linger. A thoughtful medical exam is crucial. We need to understand whether the pain is external or internal, superficial or deep, triggered by a specific activity or constant. Sometimes it's as simple as switching lubricants or avoiding an irritating product. Other times, treatment may involve pelvic floor therapy, hormonal management, treating infections, or counseling. And sometimes there's no obvious physical cause. That doesn't mean the pain isn't real. Our minds, our pasts, our relationships all live in the body. Working with a therapist, especially one trained in sexual health, can be incredibly healing. There is no one-size-fits-all solution. There are many paths that may be of help to you. Science shows that healthy intimacy and orgasm are good for your body and your mind. From releasing endorphins and oxytocin to reducing stress and improving sleep, sex can be a source of healing, but only when it's comfortable and joyful. Is every sexual encounter going to be terrific, mind-blowing, orgasmic, and bring you closer to your partner? No. Sometimes sex is just quick. You're not really in the mood, habitual, but pain should not define your intimate life. And if it does, please seek out help, guidance, and reassurance about a future without it. When we experience pain, and especially in the bedroom, common sense can elude us. Worry overwhelms us. Embarrassment overshadows the capacity to communicate with our partners. And for far too many women, sexual trauma has impacted the capacity to communicate about this part of your life. For all of us, sex should be safe. Sex should be consensual. And yes, sex should be pleasurable. And if it's not, please ask for help. Please go online to the menopause societies, the organizations for women's sexual health clinics around the country, and speak to your clinicians to assist you in realizing healing and health in the bedroom. Please, if you found this episode helpful, I hope you'll share it. These conversations need to be heard. We need to say the words, sex shouldn't hurt. And we need to believe that we deserve better. I'm Dr. Amy Novatt, and this is GynoCurious. Let's keep talking, keep asking, and keep healing together. Thank you to my co-producers, Jen Hammoud and Maddie Rosenberg, and to David Hoffman, my editor. Thank you to the Epicurean, who provides this wonderful studio to us. And I want to remind listeners that this podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and that no doctor-patient relationship is being formed. The information on this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.